my name is L Remer, and I am a co-author on the study Identifying Diagnostic Gaps and Mitigation Strategies for Older Adult Emergency General Surgery Patients. This is a scoping review. We conducted this at the American College of Surgeons, and I am a research fellow at ACS as well as a general surgery resident. It's well known that the population of the United States is both expanding and aging, with a projected 89 million people aged 65 and older by the year 2050. About half of EGS admissions and 30% of EGS procedures are performed on this older adult population, which tends to have worse surgical outcomes, such as morbidity, mortality, and higher length of stay and readmissions. Based on this, we hypothesized that there are challenges in diagnosis for this patient population, contributing to some of these worsened outcomes that we see. In this study, we aim to do a scoping review to identify what current diagnostic challenges are in the literature for this older adult EGS population, to look at tools that are being used to mitigate some of these challenges or tools for diagnosis for the older adult EGS patients, and lastly, what feedback strategies are being implemented to bring information regarding diagnosis back to the frontline clinician. We evaluated multiple databases in our scoping review from January 1st, 1990 to December 21st, 2023. Our search criteria were patients aged 65 and older who were undergoing evaluation, medical, and/or surgical management of an EGS condition. We began with 9,166 studies, and after review for our exclusion criteria, ended up with 39 studies. In terms of diagnostic challenges, these existed at the primary diagnosis, comorbidity, and complication level. The literature demonstrated obscured and discrepant clinical presentation as a common issue for older adult EGS patients, as well as delays in diagnosis, and lastly, highlighted the need for comprehensive risk assessment. Tools varied widely, however, many of them focused on frailty. And lastly, the data on diagnostic feedback was very limited. In fact, only one study existed in this space. In conclusion, in older adult EGS patients, there are challenges identified at the primary diagnosis, comorbidity, and complication level. Tools that exist to mitigate some of these diagnosis issues are highly variable. Many focus on frailty, but there's no gold standard tool. Evidence for feedback for systems and diagnostic performance is scarce in the literature. So challenges are recognized and described, and tools exist and are being studied, but there are gaps on how this can be used to improve frontline care and how to feed back this information to frontline surgeons. Thank you.